Okay, so we have Brevius Bundu Indoko from Sierra Leone. Brevius, welcome. Thanks very much for joining. Brevius is a student scholar, a second year medical student. Um, Welcome to today's edition. Before that, my name is Dr. Isaac Yeboah. I'm going to be the moderator for today's webinar. We've been joined by our speaker, so very soon I'll leave the floor for him to come and work his magic. We also have Sandra, and Sandra is a pharmacy second year student from Uganda. Sandra, thanks very much for joining today's webinar series. Yeah, we are still waiting for your brief introduction before the speaker takes over. Kindly mute yourself once you join so we don't get feedback. We also have Emmanuel. Emmanuel is joining us from Nigeria. Emmanuel is a level 500 medical student. Thanks for joining today's session. I am very much hopeful that by the close of this session, you would have gotten something meaningful regarding clinical research as our speaker is poised to deliver an excellent job today. Yeah. So thanks very much for joining, Ima. You can quickly just tell us your name, where you are joining us from, also whether you are a student or a graduate scholar. We also have Foster Kamasa joining us from Ghana. Foster is a final year medical student. Thanks for joining. We also have Gilbert. Gilbert is joining from Rwanda. Gilbert is a pharmacy student. Gilbert, thanks for joining. We hope you have an amazing time today. Yeah, so we just have 1 more minute so we can kickstart. Yeah. You also have Victory. Victory is a level 400 nursing student from Nigeria. Victory,
Are you
thanks
serious? Who is
for
that girl?
joining.
Uh,
Thanks very much for joining, Victory. We still have just 1 more minute to kickstart today's session. We also have Samuel Blessing. Samuel is a level 400 nursing student joining us from Nigeria. Samuel, thanks for joining. We hope that you have an amazing session today. We still have 1 more minute for the introduction before I introduce the speaker for today and we kickstart. Yes. So we are very privileged today to have one of our own speak to us about something very, very important in clinical practice, even as we are practicing as nurses, as midwives, as pharmacists, as doctors, as allied health personnel. Most often we engage in medical research, and once you engage in research, you need to move a step further and even go ahead to publish whatever research that you undertook. Today, we are very much privileged to be joined, like I stated earlier, by one of our own who has been taking us through a series of such or similar webinar sessions. We began last year, we are still continuing, and all this is to equip the medical scholar from the WMI community to be able to undertake research and not only undertake research but go ahead and be able to publish. So today we are very fortunate to be joined by Dr. Dikshanta Sitwala from Nepal, who is going to talk to us about building blocks of clinical research. Like I stated earlier, we started this journey last year. We are continuing, and we hope that by the close of this year, you'll be able to undertake a good research, get good data, get good conclusions and recommendations, and move a step further to even publish your research. So um, let's welcome our speaker for today, Dr. Dikshanta from Nepal, who is a member of the Medical Scholar Board, who is going to take us through building blocks of clinical research. So Dikshanta, over to you.
Thank you, Isaac. So, am I audible, right?
Yes,
Are you
you're
listening
audible.
to me? Okay,
Yes,
thank you. Are
yes.
you Is my screen visible? I'm sharing my screen.
Yes, we
Yeah.
can see your screen.
Thank you, Isaac. Hello, everyone. I am Dr. Dikshanta Sitola, a medical scholar board member of WMI, and I am basically conducting various events and research and encouraging all the WMI scholars in writing, research, case report, whatever we can. Last year, from WMI Medical Scholar Board, we organized a webinar on case report writing. I hope some of you have started writing the case report, and this is the continuity of the same series. Today we'll be talking about research. So talking about research, it's a very broad topic. We cannot finish all aspects of research writing in just 1 hour webinar. But today we'll be talking about the building blocks of clinical research, how to start it, and if there is something you tell us and we need to conduct, then we'll be conducting events or sessions or webinar in upcoming days for your support. So research is something that we publish scientifically. We have seen many cases as doctors, or whether we are doctors or nurse, midwives, pharmacists, public health professionals. So we are dealing with the health related information. So whenever we take the information, we analyze them as data, we draw a certain conclusion, and we publish it. It is a scientific writing, and this is very important globally today to to gain success as a medical student or in our professional career also. So publications counts, and it is seen in our CV. So that's why our publication, our research experience matters a lot while applying for the higher education, scholarships, or other opportunities. It's a very crucial qualification. So today's class is about a blueprint for clinical research. So why should you care about research? Because, in fact, every guideline that we follow to treat patients or to cure certain disease, it starts with the research question. So, research improves patient care, research improves the outcome of a certain disease. So, whatever we are following, whatever medication we are giving to the patient to treat certain disease, somebody started research long back for the same drug, and he drew a conclusion, and we are giving the medication. It's the findings of his research. So it's about finding something, it's about concluding something, it's about finding the association between certain disease or its causative factors. It's about finding the prevalence of certain disease in our community. It's about finding the patterns, sequences, anything that we can report, we can uh, publish as a research, and it starts with the research question. So uh, the first thing to start is to learn to ask question. It starts with the question, and we formally try to find the answer of that question. That becomes the research. And research opens doors to scholarship, conferences, global collaboration. And the interesting thing is we don't need expensive labs to do research. We can do simply school-based research. We can do community research. We can even write or research and publish it from the data that are already available in the files of our hospitals or of our office. So it's that data we can analyze, and we can find a valuable conclusion, and to publish a research from them. So, see, talking about research, uh, it's structured curiosity, not just laboratory science. We don't need lab only to do a research. The myth is that, research is complicated and only senior doctors should do that, requires big hospital or must happen in a lab. But the reality is, if we see patients, we read textbooks or attend uh, clinics, we already have a lot of questions. And in order to answer those questions, we can conduct a research, simple research. If we perform it in a structured way, we can publish it. If it meets the criteria, there are many criteria that scientific writing that a research should meet. If it meets the criteria, it will get published if we follow certain principles of research writing. So, see, the key insight is like research can start anywhere, in the clinic, at the bedside, or in the community. Anywhere we can conduct a research. So this is the hierarchy of the evidence. Last webinar we talked about the case reports. So case reports or case series is the first step. It is the lowest level of evidence. You know, if somebody, if you find certain article and you want to see how much you should rely on that article, it depends on its level of evidence. Case report or case series is the first step. It is the lowest level of evidence. And there is another uh, thing that is below the case reports, that's called expert opinion. We have been hearing this word expert opinion. It is the lowest level of evidence. Somebody's opinion is the lowest level of evidence. Case report, it is a scientific writing, it is above that. And above case reports, observational studies like cross sectional studies, case control studies, cohort studies, these are the original research. We need to follow certain ethical principle for this, we need to follow certain methodology for this, and these are the second level of evidence. And the highest level of evidence among the research are the clinical trials, where we do interventions, and these need vigorous research methodology should be followed for this. And above clinical trials also, there is another level of evidence that's called systematic review and meta-analysis, where we collect all the research that have been conducted till date on a certain topic, and we analyze all of them and draw conclusion from them. That's called meta-analysis and systematic review, which needs vigorous analysis and workup to publish. That is the highest level of evidence. So we have already talked about this case report. Today we'll be talking about this second one, that is the cross-sectional case control or cohort. It's about the clinical research. So the best thing for us is we should start from the simple as possible and learn from that. The simplest is the case reports. I have already talked about it. Case report, it doesn't need to take any ethical permission from someone. Like, yes, we need a ethical consent from the patient, but except that, we don't need to write an ethical proposal. We don't need to approve the proposal from the institutional review board or ethical committee of our hospitals. So it's the simplest one. Then the another is the observational studies. Now, this is the summary of today's presentation. So foundation of the clinical research. Everything I'll be talking in this webinar is included in this slide. So the research I'm talking, let's start from the first. It starts with the inquiry, research question. What do you want to find out with your research? In what topic you want to do research? It should be smart, specific, measurable, achievable. The same smart goal we follow for every goal setting and planning. Then then comes the study design. So what kind of a study you want to do in order to find the conclusion of your research question, whether it is simply observational study, which is easier one, or intervention study. Interventional study means you are doing certain intervention, you are like doing trials, so it is a bit complex. Then another thing that is very important is the ethical foundations. We cannot conduct any research without being inside the territory of ethical principles, because in the past there have been many research uh, projects which have violated human rights, which have violated the human ethics, and based on those projects which were considered as the dark story in the field of research, in the field of humanity, now the consensus, the scientific community have guided us to follow certain ethical principles while conducting a research, and we should always follow those principles. Otherwise, we will easily violate the human right, animal right, for conducting a research to find the To find the answer of our question, we cannot simply harm another life. Ethics is about that. And another is the sampling, because we cannot take all the population on which we want to find the answer in our research. That's why there comes the concept of sampling. We just select the representative of that population and do a study in them and generalize the finding of that sample to the whole population. And there are certain principles, statistical methods to find out the sample size that varies according to the study design, that varies according to the statistical test or analysis we are doing in our research. Okay, and then last is the data collection, analysis, writing the manuscript and sharing our research to the world. So here is a small note on the type of the study, like cross-sectional study, case control study, and cohort study. These are the observational study. Here we are simply observing the things. We're not doing any intervention. So these are observational studies. So cross-sectional study means taking a snapshot, just looking at one time only, and finding the and taking the information from them and analyzing them. Case control study means we select the cases, we select the controls, and we do the retrospective analysis of the cases and the controls. We go to the past, and in cohort we select a group of people, we divide them, we give certain exposure to one group, we don't give exposure to another group, and we just follow them up in the future and we see the results. So it's the prospective type of study. Like cross-sectional is the 1.8 time. In case control we look backward, and in cohort we look forward. So let's talk about the logical pathway of research. So the first is the question, noticing a problem. Okay, just take 1 minute and see what is the, you have been attending a patient or you are doing community activities. Just ask a question, like, in your field, what's triggering you, you want to find out the answer. Whether you are asking a patient, a certain number of patients are coming in your OPD with certain presentation, and you want to find the prevalence of certain disease among the patients. For example, you saw woman, pregnant woman who got obstetric jaundice in her pregnancy, and you want to find the prevalence of obstetric jaundice among pregnant women, in your community, or you want to find prevalence of you want to find out. Sorry for the red line, I'm not able to erase this red line in my screen. Okay, you want to study the prevalence of anemia among pregnant women in your community, so that may be the research question. Or you want to find the association between smoking and certain disease. You want to find the, the association between diet we take and pimple in the face. So that can be the question, and based on the question, based on the objective, you draw an objective, and based on that you select the design of your study. That's the plan of research. And based on the design of the study, sampling is done, and we follow certain statistical principles to select the samples. And then comes the data collection using certain research tools, whether it is questionnaire, whether it is a pro forma that you make to collect the data, whether it is interview, whether it is just a survey you send online. So you collect the data, you then analyze the data, you write the manuscript of the research based on the results you get on a certain format. Just like we discussed in the case reports, there is format of research article also. So, and you share it, you publish it. So warning is, if any of these steps are weak, the entire study becomes weak. So you need to follow every steps while research writing, but the foundation of the research is its design. Its design and the statistics. These are very important. The methodology of the study, every journal, it reviews the methodology vigorously. And if we are not, our methodology is not strong, it's not, if it's not clear, they will not publish our research article. So research question, like, it starts with the question, the research. What can be the sources of research ideas, like unusual patient presentations? For example, uh, like I talked, diabetic, the gestation. Let's talk about the pregnant women gestational diabetes. So it's not a common thing, gestational diabetes. The obstetric jaundice, it's not a common thing. So it's a presentation, very unusual presentation in the pregnancy. So we can do research on it. We can find the prevalence. Or like there is a in child, they may come as the glomerulonephritis. The number of all the child doesn't have glomerulonephritis. We want to study the prevalence of glomerulonephritis among the children that are coming to our pediatric wards. It's like unusual patient presentations, common diseases with poor outcomes. We can do research in the complications of a certain disease. So we many people have sore throat, but all the sore throat may not go to the post streptococcal glomerulonephritis. We want to study the prevalence of post streptococcal glomerulonephritis among people having sore throat, so we can study that. Or people having sore throat, how many of them go into the rheumatic heart disease? So we can do a research on that, just to find the prevalence, not anything. It's about the clinical scenario. Basically we can find prevalence uh, about anything, and differences in the practice. So we can uh, be in the same community, in the same fraternity of the doctors, we may be using various methods to treat a patient. We can compare the outcome of the different methods. For example, for the same disease, we can give medicine or we can do some surgical procedure. So we can compare these two methods of treatment based on their outcome. So we can do research on it. We can do research on local health problems in our community. So what are it comes in the public health research. So what are the barriers that to find for the what are the barriers that is preventing patients from getting the health service? So you can do a public health or social kind of research on this. What are the barriers that's stopping people from getting family planning services? So we can do that. So gaps you notice while studying, we can find any gaps, we can do research. There are many methods of research: qualitative, quantitative, mixed method they are talking these days. They are talking about implementation research. That means you are creating a certain project and you are doing research on it. So various research. So simply in starting, we can focus on certain cross-sectional studies. Cross-sectional studies is about the prevalence. We're doing one-time research. We are collecting data for the one time only, and we are taking the snapshot and finding the prevalence of something in the population. So the examples are like, why do patients present late with disease X? Is condition Y more common in urban or rural areas? Of course, we can compare urban and rural areas, prevalence of something. For example, what is the prevalence of uh, mm, lung cancer? What is the difference in the urban and rural population? We can do that. What is the prevalence of conjunctivitis? What is the difference among the rural and urban? So anything we can compare. And does lifestyle factors yet affect disease severity? So this is about association. For example, uh, if lack of physical activity contribute to the blood pressure, what is the relation between these? we can do it. So if you see it often, it is worth studying the patterns. Now, like, let's talk about the research question. Research question, we can ask question, but for doing a research, it should be guided. It should follow certain framework. Like same question, is diabetes common? Is it a specific question? No. Is diabetes common? So is it measurable? No. Is the word common measurable? No. If we are conducting research, we should be able to measure it. So what is the term to measure the commonness of the diabetes? It is the prevalence. So the strong question is, what is the prevalence of diabetes among adults attending a rural clinic in this period? So this is a complete research question. It should be clear, focused, answerable, and relevant. To make it this, there is a certain framework. We call it PICO framework. It's very important that we incorporate PICO framework in our research question. So PICO helps per population, intervention or exposure, comparison and outcome. So while making a research question, we can use the PICO framework. Let's see the previous question. Prevalence of diabetes among adults attending a rural clinic in 2024. So incorporate PICO in this. So population, what is the population? What is the population in this question? It is the adults attending a rural clinic. So adult population attending a rural clinic. What is the intervention? Diabetes. Diabetes here is the intervention or exposure. And what is the comparison? We are comparing it to the adults without diabetes. And outcome is the prevalence. So this is the PICO framework. So we should incorporate PICO framework in our study. So this PICO will be explained even more clearly in the case control study or cohort study, where we are associating certain cause with the effect. So this will be more clear. In case of cross-sectional study also, we should define our population, we should define the time period, and we should define the condition. That's called exposure in diabetes. In cross-sectional, we don't compare. So for example, PICO example, does high salt intake increase blood pressure? So here is two associated factors like salt intake and blood pressure. So what is the population? Adults is the population. What is the intervention or exposure? Salt intake is the intervention or exposure. What is the comparison group? So we are comparing the people with high salt intake with the low salt intake, and outcome is the blood pressure. What is the effect on the blood pressure? So this is important. Please note down this PICO framework and have a look on it after this webinar also. Just have some detailed study of this framework, because if you are starting a research, you should have the research question at first. And to make a research question, you can use the PICO framework. To understand it in a very easy way, now you can make use of AI. You can write to the ChatGPT and ask, what is the PICO framework in this condition? What is the population, intervention, comparison group, and outcome? It will explain to you. Nowadays, it's very easy to understand research because ChatGPT or any AI will answer it very simple way, in a very explanatory way. So I hope all of you are listening to me. This session is not that boring. If you have any questions, just type in the chat box. So let's talk about the study design. So simple observational studies are like cross-sectional, case control, and cohort studies. So cross-sectional study will give us the prevalence of certain disease or prevalence of certain condition. If we do case control study, that will give us risk factor. And if we do cohort, that will give a prognosis of certain disease. Clinical trial is of the drugs. It will give us drugs for the diseases. And case series is done for the rare disease. So we have already talked about the case reports. So the simplest study to do is the cross-sectional study that gives the prevalence of some disease. So if you want to start a clinical research, the best way to do is the cross-sectional study. The simple example of cross-sectional study is the survey. You can do a survey on anything, like you can find somebody's knowledge on something. We are familiar to these kind of studies, like knowledge, attitude, and practice of medical students towards something. So this is the simple one. For case control, you need people with certain disease, and you need similar groups, that is similar to the cases but don't have the disease. And you want to study certain risk factors in the past from those groups. And cohort study is you collect a group of people, you divide them into two groups, you give certain exposure to them, and you follow up in the future. It's also a very longitudinal long study. So today I want to focus on the cross-sectional study only. So we have already talked about this observational study and interventional study. Observation means we just watch, we just observe, we just ask questions, we don't intervene, we don't do anything, we don't give certain medication to them, or we don't perform surgery on them. This is important. The easier study for the beginners is the observational study. Among observational study is the cross-sectional study. And study design is the foundation of research. So it is about who are you studying, when are you studying, are you comparing groups, are you intervening? So it is the methodology of the study. So here you can see, think of study design as the blueprint of the building. If the blueprint is wrong, the building will not stand no matter how good the materials are. Now, cross-sectional study, I have already talked about this. This is the snapshot. We look at a population at a single point of time. It's like taking a photograph. We use it to measure a prevalence, how common certain condition is in the population, except that we can see certain patterns associated with that condition, and we explain this finding in our research. So it's the best starting point for the beginners. I have already talked about this. In case control study, you know you collect the group of people who have disease and who don't have a disease, and you go to the past and you ask, did they have certain exposure? For example, you find a group of people who have lung cancer, and you find similar kind of people without lung cancer, and you ask them about their smoking going in the past. So this is the case control study. Now, if cohort study, we find a certain group of people, we divide them into two groups. To one group of people, we give smoke, we give cigarette to smoke. To another group, they don't smoke. And we follow them up in the future, and we look at the prevalence of lung cancer among the smoking group and non-smoking group. So this is the cohort study. It requires time, it requires resources, because we are following the groups for long after the exposure. Okay, common student-friendly study designs are the cross-sectional studies. So you can do the cross-sectional studies, you can plan a snapshot study survey, and you can do it. Another is retrospective record reviews. This is very easy. So in our hospitals, in our workplace, we already have files that contain the patient details, the demographic information of the patient, name, age, gender, you know, address, and their diagnosis of the disease, and many information about them. So we can go to the file, we can extract the information from them. For example, if I'm taking the example of gynecology department, for example, let's talk about dermatology. In the dermatology department, we have the file. There is the name and age, gender, everything, details of the patient with their disease. I want to do certain clinical profiling of the patients with acne. So I collect information of all those patients whose diagnosis was acne in the file. I collect their demographic information, I analyze them, and I can prepare a simple paper based on those information. So yes, retrospective record reviews. And questionnaire-based studies means it's a cross-sectional studies where we ask certain questions to the group of people, may it be students, may it be patients, may it be people in the community, anywhere we can do this kind of studies. So these are the simple one to start with. Now another is the sampling. So population is the everyone you want to apply. For example, you want to do conduct a study among the hypertension patients. Your population is the hypertension patients, and you for those you cannot include all the hypertensive patients in your city, but you can draw sample from the population, that is the hypertensive patients visiting your hospital. That can be the sample, and the population will be the hypertensive patients of your country or of your city, you know. So this is the concept of sampling, and we cannot just take sample just like it. We need to follow certain statistical methods. We need to follow sampling Prince formula and find out the sample. And it is different in different study design. It is different in cross-sectional studies, different in case control and cohort studies. Based on the design of our study, sample size will be different. And there are many methods of sampling, like probability sampling, where you just uh, select certain sample randomly in a very systematic way. Convenience sampling means you take the samples according to your convenience, your easiness, but there are certain bias in this type of sampling. You may just take the patients or samples that's easy for you, that may introduce bias in your study. Consecutive sampling means you include all the patients, all the samples that's available. It's like a census. So these are the some methods of the sampling. Actually there are a lot of methods of the sampling. Probability sampling, there are many methods. Non-probability sampling, there are many methods. Just studying about the sampling technique and sampling formula will take another 1 hour. In today's session we will be discussing about only this sampling. If you need another session, we'll be conducting another session in such sampling only, because it's very vague topic. Now talking about the quantity and quality, we have been hearing that the larger the sample, the better the study, but it's not 100% true. So bigger sampling is not always better, but small, carefully conducted study, statistically sound sample size is better than the poorly managed, uh, large sample. There are many sample size calculation formula, and also you can use softwares, you can use online sites to calculate the sample size for its study. We'll be discussing it in later, not in today's class. If we conduct something in sampling, we can do it. Our next webinar is about statistical analysis. So in that even webinar, we may touch with this sampling size calculation. Now talking about the variables. So variables are like the measuring tools of your research. So what is your research about? If it's about exposure and outcomes, these are the variables. Now, for example, the previous study where we were studying about in the question, let's revise this. So here we're talking about the salt intake and the blood pressure. So what are the variables? Variables are the salt intake and the blood pressure. How do you measure it? Blood pressure is measured in certain units. How do you measure salt intake? Salt intake may be measured like gram per day, or this is the standard measure. We cannot measure this spoonful of salt. That's not a standard practice. Standard unit should be used to measure the variables. So in research, basically, we talk about two kind of variables. One is independent variables and another is dependent variables. Independent variables are the variables which are the primary objective of your study, and dependent variables are always dependent on the independent variables. For example, in the previous study we discussed salt intake. It is independent variables. Blood pressure is dependent variable because it depends on the salt intake. So exposure is the independent variable, outcome is the dependent variable. So now talking about another important aspect of research writing is the literature review. So before we have now we have the research question. We have this plan for the study. Now the most important thing we should do is read. We should do vigorous literature review. For example, if we are conducting a research on association between the salt intake and
Oh, they are fighting with the blankets. Their
please
arms
mute,
up, up.
please kindly mute your microphone.
We can do, but we don't have a bed ready. Because if we had it, you put, then you just put the blanket.
Azirio, okay. So literature review. So if we are doing research in salt intake and blood pressure, we need to, find at least 10-20 papers, previously published paper, similar kind of papers, and we need to study them. This kind of research, they might have been conducted in different countries outside your country, outside our community. We need to read those, we need to see the results of those studies. That's called literature review. It is the purpose of the literature review is to understand what is known, you know and what is the gap in the study, what is still to be done in that field, and we can refine the question based on the literature review. This is very important aspect of the research writing. So we have already talked in our previous webinar about finding or searching a paper in PubMed, downloading and reading it. Even we have talked about the piracy, sci-hub, from where we can download many papers which we cannot get open access. So that's like the torrent of the research paper. So we can download those papers and read, because we need to do extensive literature review before starting our research, before writing the proposal of the research. Good literature review doesn't mean understanding and summarizing studies. Means but not copying them. It's not about copying the same research. We need to understand them, we need to find out the gaps in those studies, and we can plan to address those gaps in our study. It's not about copying the sentences from the previously published articles and writing in our research. It will give rise to plagiarism. Another important aspect of the research is the ethics. I've already talked about this. It is non-negotiable. Any study that involves humans or even animals, ethical principles should be followed. So what are the main components? It's like protecting rights and dignity, informed consent, it compulsory for the research if it involves human population, confidentiality, minimizing the harm to the people or animals. So it's called the Helsinki principle that have given us the consensus of safety, ethical guideline. So whether we are conducting a research in USA, whether we are conducting research in Nepal or in Japan or in Europe, everywhere, ethics is non-negotiable. So if you are conducting a research in your community, in your medical college, you should take the ethical approval from the concerned body. Maybe there may be ethical committee in your medical college or in your city, go as a governmental body. You can take from the ethical approval from them. In Nepal, basically, the ethical approval is given either by the ethical committee in the medical college or the government body which governs all these ethical scenarios. So this is non-negotiable. The, After you find your research question, you design your study, you should write everything and make a proposal for the ethical approval. And once you get the ethical approval from the ethical committee, then only you can start research. Otherwise, you can't start research in the human population. Now, once you write the research proposal and you start collecting data. So for the data collection, you need the tools of the research. So I have already talked about this. To collect the data, tools may be the questionnaires, interviews, or simply pro forma that is used to collect the data from the files that are already recorded. So to collect the data from recorded files also, you need a certain format, you need a certain pro forma, and according to that pro forma you can collect the data. And then the collected data it is stored in the protected safe computer or system, and then you can analyze the data. For data analysis, again, you can use the software. We'll be talking about data analysis in upcoming webinar. We have a webinar on this. Now let's talk about the common structural failures. So starting without a clear question. The first thing to start a research is creating research question. So it is the first step. Choosing projects that are too large. Sometimes we become too ambitious, you know, to do research. So we plan big without having necessary competence. So if we are not competent enough, then our aims should be small. At least we should try to take small step. Otherwise, we cannot do that. So to start with, we can start with the small projects, and once we get the experience of research, then we can plan something big. So unclear inclusion and exclusion criteria, like the population of your study, the sample of your study, whom to include and whom to exclude. This should be clear. Mixing different populations, unclear population. We talked about the PICO framework of the research question. So population should be defined, and changing criteria midstream. So you planned research on certain population, and in the mid of your study you change the population. You just picking up random people without meeting the criteria. And ignoring ethical requirements, again, ethics is the foundation, it is non-negotiable. So all this will lead to failure of the research. I didn't know what is coming in my screen, all these lines. So about this slide, I talked in the beginning of this webinar. So all the things I discussed during this period is included in this slide. This is the summary of today's presentation. So you start with the inquiry, you start with the research question. Research question is all about PICO. What is your population? What do you want to study in your population? In which point of time? If you are doing comparing between association, what is the exposure and what is the outcome? And what are you comparing? So PICO framework and inquiry. Then comes the study design. Whether your study is observational or interventional. To begin with, start with the observational. Among the observational study also, cross-sectional study is easy to start with. So cross-sectional study you can conduct as a questionnaire-based survey. You can do a cross-sectional study of the already recorded data in your files, in your office or medical college. So you can do online survey also. So this is easy to start with, except that other couple observational studies are case control study, where we will be looking backward, cohort study, where we'll be following forward. Another important aspect is the ethical foundations. Once you design your study, then you need to write an ethical approval proposal. So your research proposal, and you should submit it. So once you submit your research proposal to the ethical committee, they will evaluate your research proposal. They will complain about you if it violates certain research principles. They will evaluate the statistical method and methodology of your research, and they will give you feedback. And once all the criteria is met, only then they will give you ethical approval and you can start your research. Another important aspect of the research is the population versus sample. The population of the study, you cannot include all the population in your research. You cannot do, research in millions of people with certain heart health condition. But what you can do is you can take a representative sample from this population using certain sampling formulas and statistical um, calculations, and you can conduct your research in the smaller group of the sample. And another is the data collection, analysis, and sharing. So for collecting the data in the sample, you need research tools. So you can already use already standard research tools. If you are creating the research tool or questionnaire by yourselves, you should validate it, which is another process. Validation of research questionnaires is another process. It will take need another 1 hour to explain the validation. you know okay. And analysis, once you collect the data, you can analyze it. Analysis of the data also requires softwares. It requires various tests are involved. You may have heard about chi-square test, t-test, peer t-test. So there are many tests which we do in our data, and we can compare or we can analyze our data. So we will be talking about this in our analysis webinar and sharing. So talking about all this, research writing, it's a very long topic to discuss. We cannot just some tell everything in this 1 hour, but today's class is about just orienting yourself in research writing. So any questions you have, or you are interested to conduct a research in your community, and you can text us in medical scholar board, or you can text me where I can provide you my opinion and my knowledge on your topic. So if you are curious, if you want to start, we are there for you to support, but you should start and start seeking about the research, because it was in internship I started my research writing. I conducted my first research to find the prevalence of obstetric jaundice, because I was talking about obstetric jaundice before. That was my first research among the pregnant women. I collected the data from the files of the pregnant women, the past records, and I analyzed the prevalence and its associated factor. I conducted some tests to find the association, and I published it. It was published in PubMed Index journal. So, and I learned a lot from that project, because I was involved in every part, like from proposal writing to the manuscript writing and publication submission. Everything I did with the help of my mentor. So you'll always need a mentor to support you for the research. You can't just do research singly in your beginning days. So we are there to support you. Whatever help you need, you can contact with your seniors, or you can contact with your faculties or professors to get help for the research writing. Yeah. Now, this much for today. I think I covered a little bit of everything. Actually, this is a very uh, good topic. I think I had a question. Where are you? Were you a medical student? Yes, I was intern. Okay. Ata, I was intern when I conducted my first research. I conducted it in gynecology department from the past records of female to calculate the prevalence of obstetric cholestasis uh, uh, among the pregnant women. So thank you, everyone. I think this is not a very enough about research. Today's class is of just about orientation of research. It's a very big topic. You will need explanation in every step of research writing. that I discussed today. Whatever help you need, just write to us. If you need another webinar in coming days, I'm ready to give you, you know, webinar about research writing also. We have already planned something ahead, but if you need extra events, I think we can manage. So if you have any questions, please write to us or you can ask the questions. Any questions, everyone? Have anyone of you worked already started your research?
Good evening, good afternoon, sir.
Hi.
Yes, sir. Okay, so I wanted to ask a question. And funny enough, it's related to the research you said the first research you said you carried out. So I was going to ask if because I had a research idea, but then I'm still like in medical school, so I was not really sure how this would it would be to carry out such a research that required me to go patients' data. So the research is the prevalence for surgical infections in AKIS surgeries in my teaching hospital last week. So there was this research competition or challenge that I came across, and I just decided to like put that together and yeah to submit that as a research proposal. So I was going to ask if that kind of study, like a retrospective study, is like feasible for a medical student to perform. You know, what it would be like trying to gain maybe gain a mentor or just trying to gain one of maybe soldiers or just trying to get someone on board for that kind of research. I was really just going to ask if that's a very feasible research for a medical student to carry out.
Hi, Favor. Sorry, I don't know I get all of your question or not, but I have listened something. So, as a medical student, if you want to do a research, so the best research to start with is the cross-sectional study. That may be a survey among the medical students, or if you have community field visit, you can do a questionnaire-based research with and the people in the community asking them about certain things, or you can also take help from your teachers because you cannot do as a medical student if you haven't done previously. And research is not an individual task, it's a group work. At least 4 or 5 people, they can be together and plan a study and do. It will be better to begin with the research. So you can talk to your professors if they have something already, they are starting something to do, and you can contribute in their study. Just negotiating with them whether they can put your name in the research, if you have significant contribution, and if you are involved in 2 or more research like that, then you will get some idea and you can start your own research. So the best thing is like you can conduct a cross-sectional survey among the students also, or if you have data already available in your medical college, if you are doing ward rounds or something, and if they permit you to use the data, you can use the data and do a research. But the best thing to start a research as a medical student is taking help from the seniors, especially faculties and professors, because they need publications for their promotion and they are already planning to do some research. If you make good relationships with them and if you ask them to be a part of their research, if you contribute them, you learn about it. If you work in 1 or 2 research, then you can slowly conduct your own research. I hope I answer your question. Sorry, I was not able to listen all of your question. I couldn't listen.
Okay, so I was also going to send you a message, but yes, I think you perfectly answered my question. Because I was really just going to ask, like, how to build a relationship with them to get them on board to like want to work with you. But I think you answered it perfectly. Thank you so much.
Trevor, I think I'm not able to properly hear your audio. I don't know what's the problem with the audio, or is it my laptop that's um okay, I have another question from Brevius. Recommendation how to identify find a mentor in a case one already has a research question or proposal to build on. So it's about, because you have already have a research question or proposal to build on, then you can search for the mentor that's working on the similar kind of subject or similar field. If your research question is about the heart disease or something, then you can seek a mentor from the medicine department. If it is about gynecology, you can find a mentor in the gynecology who is from the same field. uh, they may help you, so that will be the good way. Or you can ask your seniors. Not all the people from the department will know research. Even I can say that all the gynecologists can be a mentor, because some of them may not know the basics of research. So it's about you need to spend a little bit of time with them in the department. Then you can find the mentor. And also you can see if your mentor or faculties are active in LinkedIn about their research experiences. You can join a site called ResearchGate, where researchers, it's like the Facebook of researchers. ResearchGate, where researchers publish their work. You can find your professor's name in your ResearchGate, source for their articles. So because in our medical college also there are a few professors who are keen at research, they are you know enthusiastic about research, so those kind of people you can ask for help. So another one is Rachel. Yes, please, you can message me anytime about research. That's why I'm here in Medical Scholar Board of WMI, to provide my experience, to share my experience with you, to provide you information. If I know any, you can message me always regarding research. So another is from Emmanuel. I have been having thoughts on how to go about publishing. Okay, if you are currently doing your personal research, then congratulations, Emmanuel. Yes, are there opportunities to publish in high impact journals? Yes, of course, there are lots of high impact journals that publish the articles from the low and middle old countries freely. They will provide us waiver. Even my country, Nepal, is eligible for the waiver of the article publication charge. So but the thing is, like, if it is a standard journal, then your article should also meet certain standard. It should follow certain principles. It should include certain analytical standard. Then they will publish it. And also, from the Medical Scholar Board also, in our monthly opportunity email blast, we are sharing with you about various high impact free to publish journal names. So we'll be sharing about more about the journals that will publish original research articles also. We'll be sharing about it. And can we get your slides after the meeting? Yes, I'll provide it to the medical scholar board, and they will provide the slides to you. No problem. I'll provide the slides. Also, I have just, it's Michael. You have conducted a survey. Congratulations, Michael. You conducted a survey for a cross-sectional research. What comes next after the survey? So I don't know how you started a survey. You plan for a research and you plan for the analysis plan and you started a survey, or you just do a survey and now publish a research out of it. So it depends. But if you already have the survey, then the thing is, like, you should first take the ethical approval and then you start the survey. Doing a survey first and then taking ethical approval, I don't know they will give ethical approval from the committee. But you can still collect your data and analyze it. Uh, so as a retrospective, you can because somewhere they may allow it, but I don't know they will allow it to publish at a research, because the principle of the research is first you take the ethical permission approval and then only you start the data collection. So otherwise you can try it in a retrospective way as a, you know, analysis of the retrospective data. You can write a proposal in that way and you can submit it to the ethical committee. If they grant you the permission, assuming that your all the ethical and statistical criteria is met, then you can analyze and publish it. So yes, Michael. So anybody have any other question? I will provide this slide to the medical scholar board and they will provide it to you. So everyone, if you have any question, then so if you don't have any question, then I'll hand over the mic to our medical scholar board in charge, Isaac. Isaac.
Yeah, hello, Dikshanta. That was
Yes.
an amazing presentation. I,
Thank you.
I myself, I was taking down some notes when you were delivering the session. I have taken down a lot of notes because this year I told myself by close of this year I should at least be in the process of publishing my first paper. So I've taken a lot of notes with regards to the various type of research methods, as well as even how to do a proper sampling and the others. So yeah, thank you so very much. Your webinars have always been very, very inspirational to the medical community, especially regarding the research focus. We really appreciate all the things you've been doing for us with regards to the medical scholar, but I think there are no other questions. If you do have any other question, you can just ask on the page. You can also DM me, forward the question to Dikshanta, and he would answer for you. We'll be sharing the slides via email. You can also DM me so that I send it to you. But we want to thank each and everyone for making time out of your busy schedule to join today's session. It's been an amazing session. I want to thank our speaker, Dr. Dikshanta, and to everyone who joined. I saw on Dr. Onisai. I also have seen Dr. Justice on call. I want to thank you all. The slides I said earlier would be made available to you. If you do have any questions, please kindly send it to me on the page, or you can DM Dr. Dikshanta personally. I think there's a question in the chat box. Is clinical research classified as participatory action research or traditional research? I think, Dikshanta, you can take this last question, then we draw the curtains on today's session.
Okay, thank you, Samuel, for the question. Is clinical research classified as participatory action research or traditional research? Oh, I don't know the exact answer of this question. Is it traditional or it is? I don't think clinical research is traditional one, because it's actually research methodology are going to, it's updating every time, but I can know, I don't know what you are trying to ask with this question. It's a participatory action research or traditional research. I will answer this in the WhatsApp group after researching. I think I need to research this question more. Thank you, Samuel, for the question.
Absolutely, absolutely. So Samuel, we shall get back to you on this question. So yeah, thank you once more for joining. Thank you very much, Dr. Dikshanta, for today's session. We hope that you join us for our next session in 2 weeks' time. I want to thank you once more, and do have a wonderful and amazing week ahead of you. Oh, thank you, and have a nice day. Bye.